Dr. Meena. I'm Dr. Meena Puraj from TBPPM Learning Network India chapter. I welcome you all to this Let's Talk TBPPM series organized by TBPPM Learning Network India chapter. TBPPM Learning Network India chapter is a community of practice which brings diverse stakeholders to one platform to encourage cross learning and foster collaboration for public private engagement for TB control in India and beyond. At TBPPM Learning Network, we have initiated this Let's Talk TBPPM series, which covers a wide variety of topics related to private sector engagement in TB elimination efforts. In the first webinar of the Let's Talk TBPPM series, we will explore today the STEPS framework for TB elimination efforts in India. The acronym STEPS stands for System for TB Elimination in Private Sector. To give us an overview of the STEPS model, we have Dr. Rakesh with us today. Dr. Rakesh PS is the Deputy Director Programs from the Union. He's a medical doctor. He's a public health intervention specialist who works for low cost, sustainable solutions and building resilient health systems. He has been working for TB elimination for the past 10 years. He was a WHO consultant in the TB program and contributed substantially to framing strategy documents and supporting the TB elimination mission in Kerala and Lakshadweep. He is also a Bernard Lowndes Scholar in Cardiovascular Health and a visiting scientist at the Department of Global Health and Population at Harvard T.H. Chan School of Public Health, Boston, USA. We are very happy to have you, Dr. Rakesh. Please give us an overview of the STEPS framework. Over to you, Dr. Rakesh.
Yeah, thanks, Meena. I'm very happy to see all senior people in this webinar, and we'll be talking in this webinar very soon. So without much introduction, I will just get into my business of explaining what is STEPS framework. Dr. Shibu Balakrishnan, who is the WHO MPO, was supposed to do these presentations, but unfortunately, he has been called to office for another important meeting. So I'll be presenting this on his behalf. The STEPS or System for TB Elimination in Private Sector, which is a private health service delivery provider-led initiative to end tuberculosis. So basically, we all know about the standards of TB care in India. It is a customized, it's an adaptable version from the international standards of TB care. It clearly talks about the minimum set of standards that every citizen in India should receive, irrespective of where he or she is getting the treatment from. The STCI in India has been formulated in the year of 2012 with participation from 120 experts, including clinicians, public health managers, policymakers, from public sector, from government sector, including professional associations and the TB people who suffered from tuberculosis altogether, sitting together. So they decided that these are the minimum set of standards that every citizen in India should receive, irrespective of the facility in which they are getting the treatment from. And the vision of the NTEP, the national program, also shifted at that time to the vision that people suffering from TB receive the highest standards of care and support from the healthcare providers of their choice. There have been lots of studies done, operations research to find out why it is difficult for the private sector to engage with the national program, or why it is difficult for the private sector to ensure standards of TB care to the clients reaching them. The standards of TB care is considered as equivalent to the quality of TB care generally. We can equate it to the quality of TB care. There have been lots of studies, and similarly, some of the studies have really, most of the issues are well known with related to what are the concerns of the private sector while collaborating with the public sector. There are also concerns on the public sector while collaborating with the private sector generally. So all these concerns were really well documented through multiple research studies generally. Right? I'm not going into details of that, but what I wanted to highlight is these concerns were well documented. Most of the concerns of the private sector were like, say, for example, there is a poor recognition from the program, that there is an apprehension about losing the business because clients are reaching them for getting their treatment. Important considerations about the patient confidentiality, too much time for reporting sort of stuff, and lots of other hurdles generally with related to the concerns of the private sector. So what has been initially done is basically most of the hospitals were actually notifying TB. Private hospitals were actually notifying TB. But say, for example, this is a study done in Amrita Institute of Medical Sciences, which is a big tertiary care hospital network. So they were notifying 15 TB cases per quarter regularly, right? So, but there was a somebody inside the hospital itself, they felt that, okay, fine, this is not complete. So how could we ensure that notification is complete from this organization? Yes, we are notifying. All hospitals are notifying, but how can we ensure that the notification is complete within the organizations, right? So they just try to check whether the notification is complete from the organizations through pharmacy sales, drug sales data, through the medical records department, through the data available in the laboratory. They figured out that, okay, fine, it's not complete. They figured out that it's because there is no system within the hospital which can actually compile or collate all these informations and notify, right? Because inside the hospitals, especially big hospitals, they have multiple departments. They have cardiology, neurology, nephrology, ortho, pediatrics, medicine, pulmonology, all departments will be there. And generally, TB, all the departments generally, they deal with TB, tuberculosis, right? So we need to have a single window mechanisms of information flow within the hospital to ensure that all the notifications, all the cases are being notified. So this was the starting point or the beginning point of thinking about a system within a hospital general, right? So once they established a system within a hospital, their notification improved from 15 per quarter to 85 per quarter. So it's a huge jump in the notification that happened within the hospital itself. So that means so many cases were there which were actually missing, not intentionally, but this was missing because there was no system within the hospital at that point in time. Another effort was also made to find out what is happening to the people who were notified, who were initiated on treatment from a tertiary care private hospital, right? So they figured out that without any support, 70% of the people who were being initiated on treatment from a private hospitals were completing their treatment regularly. So they were completing their treatment, right? But unfortunately, 21% of the people who were initiated on treatment from the hospitals, their details could not be obtained and they were considered as lost to follow because they were not continuing the treatment at this moment and they could not be traced or contacted at that particular point of time. Yes, this was an issue. So this was recognized as an issue as there is a leak in cascade of care identified among people who were getting treatment from the private hospitals, as there was no system there again to tag or highlight saying that, okay, fine, there are people who have been missed. There are clients who are not coming back to you sort of stuff, right? So now for the program, this we call them as loss to follow up or initial loss to follow up, whatever it is. But for a private provider, this also means it's a business loss. It's a business loss. For the program, it's a loss to follow up. But for a private provider or a private hospital, it also means a business loss. That means my client is not coming back to me for some reasons, right? So that's because of the peculiar health-seeking behavior. They may even go to another hospital. They may even go to government. They may not come back. So whatever happens. But this is a loss to follow up generally as far as the private hospital is concerned. So considering all these things, say, for example, all the studies that has been undertook, which documented the concerns of the private sector, concerns of the government sector, and all the experiences with establishing a system within the hospitals, then evolved a model known as STEPS, which is System for TB Elimination in Private Sector General. So this has been conceived in consultations with lots of private providers. They led this initiative in the sense like they gave all these contributions of how this model should be in this form. So it has basically three core components. One is a step center within the hospital. Like every hospital will have something like a step center, right? So that will act as a single window system within the private hospitals to ensure that all clients reaching them are receiving the standards of TB care in India. There is a private hospital consortium. So there is a consortium of the hospital managements. So generally, in all the PPM efforts, what happens is all the focus were generally focusing on the doctors, but there was a felt need to engage the managements generally. So all the top managements of the hospitals, they came together and they tried to form a consortium for of the private hospitals. They provide policy support. They review the private sector engagement activities. So I mean, if people working in the TB program could visualize this as a the task force mechanisms for the medical colleges. Say, for example, all the medical colleges, there is a core committee inside. There is a state task force or zonal task force or national task force. They come together and they review their performances basically, right? So that's how a private hospital consortium has been formed. And there is a coalition of professional medical associations in each city, right? So it has been envisioned in this way. The coalition of professional medical associations is for the doctors basically, and that constitutes under the patronage of Indian Medical Association. There are lots of other associations like pulmonologist associations are there, Indian Academy of Pediatrics is there. So there are at least 18 to 20 associations of doctors who are actually dealing with tuberculosis. So basically, the coalition of professional medical associations is to sensitize their individual members. It is to advocate with the doctors for following STCL. So steps, basically, if you generally look at the steps framework, it has three distinct components. One is a step center within the hospital. There is a private hospital consortium, and there is a coalition of professional medical associations. All these together constitutes what is known as the steps. A bit in depth into the system within the hospital, generally how it looks like. Basically, there will be the hospital management will dedicate a person. They will designate a person as the steps coordinator. There will be a system within the hospital management basically. So they say that this is the person, this is the information flow that need to happen like this. All the information related to people with TB will reach that particular person or a particular system, right? In some of the major hospitals or big hospitals, the infection control department will be handling this one. In smaller hospitals, it will be a nurse or typically a PRO or somebody or a person sitting in the reception who will be handling this responsibility. Like it's based on that hospital's arrangements. It's an internal arrangement by the hospital. They basically provide guidance, support, and linkage to the clients for all public health actions. The particular steps coordinator or the steps lead, whom we call as, they guide, they support, they link the people for the public health actions. What they will also do is they will call their clients on a periodic basis. Say, for example, once every week or once in a fortnight, they call their clients, all clients with tuberculosis. The nurse will call on behalf of the hospital and check with them. I'm calling on behalf of your doctor from this hospital. And how are you doing? Are you taking your medicines regularly? Do you have any adverse symptoms? You have, I mean, when during the time of guidance itself, they might have established the rapport. Their numbers will be there with both of them. So there is a person in the hospital whom the person affected with TB can always contact and talk. There is a provider-initiated telephonic follow-ups. This is something like an after-sales service model. So once we buy a car, what happens is we used to receive calls from the customer care asking about the satisfaction, how the customer care services were. We know that that is a mechanisms in business to foster customer loyalty. And we all know that loyal customers will always bring back the business in one form or the other form, right? So this is basically a model based on the social responsibility of the private sector, but at the same time, there is a customer loyalty, fostering customer loyalty built in between. So there is nobody in between the private sector and the client, but there are so many people to help the private sector in establishing these systems like PPSAs and all. They help the private sector in establishing such systems basically, right? So they establish such systems. So there is an exchange of information happening, and finally the patient completes the treatment successfully. So the provider initiated follow-up of the clients ensure that, and the public health actions ensure that they receive the standards of TB care. That's the basic philosophy of the STEPS model. I'm not going into details of any of these things, but this is how generally they ensure 100% notifications within the hospitals, information from the lab, pharmacy, the medical records. There will be a triangulation. There will be steps links in each departments, and they will coordinate with the steps coordinator to ensure that informations are being exchanged generally. And the steps coordinator, they enters the information in Nikshai to inform the government with related to all these things that are happening inside the hospitals. So hospitals design their system in their own way. based on the philosophy, right? So there will be hospital management at the top. There will be somebody who is overseeing these entire activities. There will be steps coordinator and the steps links within this hospital. We could see that various hospitals are designed in their own way, and they have their own protocols, guidelines for managing tuberculosis. So once the philosophy is that once a person enters the facility, all services are provided then and there itself by the provider through a provider-initiated approach, fostering customer loyalty and based on the social responsibility to ensure that they complete the treatment successfully. The private hospital consortiums, they have been formed. I already mentioned about that. So such consortiums are throughout there. This is a photograph from the launch of the steps. This has been initially piloted in the southern state of Kerala, where we could see the Dr. Soumya Swaminathan, the chief secretary at that time, Dr. Rajeev Sadanandan, Dr. Prem Nair, who is the director of the Amrita group of hospitals. They all came together and they launched the STEPS program. And after onwards, we could see that all the hospitals, they actually owned this program up and they started joining all these initiatives. And currently, in the state of Kerala at that time itself, there were around 324 private hospitals who joined this STEPS movement. We could see the entire hospitals in a district, they joined STEPS in Wayanad in this photograph. And this is how generally they commit. As a member of consortium of the private health facilities, we are committed to ensure uniform high standards of TB care to all the clients who seek care with us. So this is the commitment that the private hospitals actually try to provide. Obviously, yes, government, the national program, they try to help the private sector. When they came together, they provide trainings in all forms, trainings of the steps leads, trainings in the NICSHI, all these things the programs generally try to provide. So there is a review that happens within the hospital by the concerned management representative. They review the activities that is happening within the hospital with related to tuberculosis generally. Some of the hospitals, they have earmarked dedicated rooms for steps for initial counseling. Some of the hospitals, they have even earmarked dedicated staff for steps. Say, for example, if you look at some of the hospitals, they have a staff who has been exclusively dealing with taking care of people with tuberculosis. They follow up the people with tuberculosis, they ensure consent linkages, they ensure transfers, and salaries being paid by the private hospital managements, basically, right? So that hospitals has gone to that level, even with related to steps. Generally, many of the local solutions has actually emerged. The review formats, the WhatsApp groups in many of the districts, the entire providers are being connected using WhatsApp calls that include stroke managements, their private hospital steps coordinators, and they communicate very regularly. The private hospital consortium, they generally review the activities of the step centers within a particular city or a particular districts generally, and they generally try to review the activities of the steps. I already mentioned about the Coalition of Professional Medical Associations, the Academy of Pulmonologists and Critical Care Medicines. They also play a key role in the Academy of Pediatrics, all the associations generally, including geriatricians, specialist associations. They all come together and they try to advocate with their members on ensuring STCI to all their clients reaching them. So these are all the photographs from the Coalition of Medical Professional Associations. Even during COVID times, we could see that they were meeting virtually. And during COVID times, when the notifications went down everywhere, so the entire coalition of associations, they came together, they tried to provide a call for actions with related to things. Documented improvements in the quality of care, the documented improvements in the standards of TB care. This has been well documented after the implementation of the steps in terms of increase in the notifications, increase in terms of people receiving DBT, people knowing their HIV status, increase in the reporting of the treatment outcomes from the hospital itself. So when the PPSA light, they withdraw in 2020. After 4 years, even after 4 years, we could see that the model is self-sustaining sort of stuff, and without any external interference or external influences, the model is actually self-sustaining in its own way. And when the trust improves between these sectors, when there is a platform for dialogue, like private hospital consortiums, which serves as a platform for dialogue between the private sector and the NTEP, generally the trust improves. And many places what we have seen is that the overall sale of the anti-TB medications, they also actually came down drastically in Southern State. There was a formal evaluation by all stakeholders was done for steps, which has revealed that it's an acceptable model to all stakeholders. Clients were really satisfied. Say, for example, imagine the happiness of a client when the hospital is calling them and checking with them, are you taking your treatment regularly? I have interviewed personally lots of clients, lots of people affected with TB, and they were really happy. They said that if such a system was there, my father would not have died 4 years back. So this was the comment, exactly the statement given by a gentleman who was suffering from TB now. He was saying, if such a system was there, and my father would not have died before. So the data also, data quality assurance also was thoroughly checked, and it was found out that it's good. Quality of TB care indicators generally improved, and economic evaluation was also done, which is revealed that it is a win-win-win-win model. So everybody is winning in this model. The patient is winning because the hospitals are constantly following it up. They complete their treatment. They successfully complete their treatment, including all their public health actions and standards of care. That is with or without the support of the national TB program that has been customized by each private hospitals based on their need, basically. The private hospital is happy because their customer satisfaction improves, their customer loyalty improves, and it's actually a kind of a social responsibility, a social commitment based on a profitable customer care model. The government, the national TB program is happy because half of their load is being managed well by the private sector without any emergence of drug resistance or any laws to follow up in their terms. Society is happy so that private sector is contributing well, and the government is also contributing. Both of them shares their hands together, shoulders together, and trying to with the society as their final beneficiary in product sort of stuff. Generally. Right. So many of the hospitals, they started doing intensified case findings nowadays, and they started screening all the clients reaching the hospitals for TB to address the delay in diagnosis issues also. During COVID time, what we have seen is that the entire network, because of, since there was a strong network of hospitals, the private sector was really organized at that point of time. What we have seen is that the steps has actually transformed to from a system for TB elimination in private sector to a system for total engagement of private sector. So this system, through this system, now all the national programs are interacting with the private hospitals, including immunization program, including IDSP, the Integrated Disease Surveillance Program, whatever it is. So this will act as a platform for integration of all national programs with steps as an interface between private and the public sort of sector generally. So as of now, today, there are 1,208 step centers spread across 7 states in the country, India, with 18 city hospital consortiums and 15 district coalition of professional medical associations. And we could see that AHPI, the Association of Healthcare Providers of India, I could see Dr. Sunil Ketrapal here. We could hear from him their commitment of establishing steps and how they are engaging. Also see Dr. Upasana Arora here, who is a vibrant leader, how their leadership is transforming, showing their commitment for ending TB in India. I could also see Gracie Matai, who is the chair of private hospital consortiums of TB-free Calicut. And Calicut is the only district where during COVID times, when the entire notifications went down, that is the only district where I could see that the notification was remaining stable throughout, not only public or private, but the total notification was remaining stable throughout because of the good engagement between public and the private sector hospitals through steps at that point in time. I will also see Dr. Sanni P. Orathil, who is a leader, who is a superintendent of one of the private hospitals, Rajagiri hospitals, and who generally provides leadership to all these initiatives. So this is being led by the people who are the leaders in the private sector and their associations generally. And as a last slide, what I want to tell is it is a private sector-led initiative where private sector assumes the responsibility and accountability. It's based on the multi-sectoral accountability, where they also assumes their accountability to ensure that all clients are receiving the standards of TB care. It is a patient-centric model. Basically, the private hospitals, the patient is at the center always. They provide options to the patients, what they really want. If they want to get transferred to their nearby facility, they will link with them properly, successfully link with them, and ensure that that is being linked. If they want any of the facilities free of cost related to the government, they provide all the drugs, medications, diagnostics at their facility itself, at the private facility itself, at a cost, free of cost. So it's a patient-centric model where patient is at the center. government or the national program and the private sectors are working towards where the patient is at the center. The entire thrust of this model is on the quality of care, and it's basically a social responsibility based on profitable customer care services. And on last June 2024, there was a declaration. It is named as Kochi Declaration, where the Stop TB partnership has brought in the coalition leaders of 12 countries, including India, Indonesia, and African countries. They all came together. The coalition leaders of the 12 countries, they came together. They understood about steps. They visited many of the facilities here, and they actually made a declaration which is being labeled as Kochi Declaration of 2nd June 2024 by the Stop TB partnerships, leaders of the Commonwealth medical associations and national medical associations of the 12 countries. We could see the Dr. R.V. Ashokan, who is the president of the IMA, also sitting here. So like that, similarly, 12 countries, associations, they came together and they really committed that they will also try to establish models like this, which are low-cost, sustainable models led by the private sector based on their accountability. I think I will stop it here. Thank you so much, TBPPM Learning Network, for giving me this opportunity for present. Thank you so much.
Thank you, Dr. Rakesh, for sharing your deep knowledge about STEPS framework and your commitment towards TBPPM in India. We really see that in the papers you have published and all that. So this is truly innovative, I would say, because of its multi-level engagement through the creation of STEP centers, private hospital consortium, and medical associations. So this is making us to building curiosity now for us to learn more about the steps model. So in the thank you so much for that, Dr. Rakesh. So in the next part of the webinar, we are going to have a panel discussion. So in this panel discussion, we have an excellent line of speakers who are going to bring perspectives from the field. They are actually representatives of different stakeholders who are integral part of STEPS framework. So they are going to share their perspectives, drawing from inspired from implementing this model on the ground. So to begin with, we have the first panel member, Ms. Gracie Mathai. Ms. Gracie Mathai is the CEO of Baby Memorial Hospitals, Calicut. She is a veteran in hospital administration with more than 40 years of experience after her graduation in nursing and MHA from Tata Institute of Social Science, Mumbai. She also holds a master's in human resource development management from Mumbai University and a postgraduate diploma in medical law and ethics from National Law School, India University, Bangalore. She also worked as a nursing director at Leelavati Hospital. She has extensive experience in administration of hospitals in India. She's a certified green belt in Six Sigma accreditation coordinator, principal assessor of NABH. She was honored with FICCI Award in 2023 for excellence in healthcare leadership. We are very happy to have you, Ms. Gracie Mathai. So we have some questions for you. So we request you to address these questions in your presentation. So you've been the chair of the consortium of private hospitals with steps in Calicut district. So what were the key takeaways in leveraging this consortium to support TB elimination efforts in the district? Also, we would like to know what are the possibilities of using this consortium to strengthen the public-private partnership in TB control and beyond. What major discussion points have emerged during the meetings of this consortium? And also, we would like to know how, as this consortium effectively addressed the issues that emerged. Yeah, so these are the questions we would like to hear your thoughts and reflections on this. Over to you, Ms. Gracie Mathai. Thank you.
Thank you, Dr. Meena, for that wonderful introduction. And I really appreciate Dr. Rakesh, who has already given or reduced my job, because in an elaborate way, he has already explained how the step is working over here. And I'm so happy that in Calicut district, we have already initiated a consortium, and the consortium was initiated from 2019 onwards. And then I can give you the details of that consortium and how we, as well as the TB patients, have been benefited by this consortium activities in the Calicut. Now, when the consortium was being developed in the 2019, the chairman of that consortium was considered as the chairman of my organization was considered as the chairman of that consortium. Now, because my chairman could not attend many of the meetings, so he has directed me to attend. So I become part of that consortium from the beginning onwards. Now, the private hospital, it is the response, it is actually the initiation of the, what I can say, the district collector of Calicut, who came forward, as well as the district TB officer, who came forward and who have suggested for forming this particular type of consortium. Earlier, what has happened, as Dr. Nagesh has very clearly said, hospital-wise steps, things were going on, but the reporting was not to that extent how much they have expected from the private hospitals. Hence, this has been shortened, and the vision of this consortium was to have a TB free Calicut. And our mission was to ensure a uniform, high standard of TB diagnosis and treatment to all who seek care in the private sector of Calicut district, and to ensure all public health services, including contact investigation, treatment adherence support, TB preventive treatment, support for airborne infection control to the patient as well as to their families. Now, as I told you, the chairman of this was my hospital chairman, Dr. KG Alexander. Now, today I am here on behalf of him, and we have about 42 private hospital owners as a member of this consortium. And the secretary was the district TB officer. Of course, the collector was always there, and he was the leading person who initiated and then who has supported us from the beginning. It is established in 2019 and meets biannually. And what does we do? It review private sector contribution in ending TB and coordinates and troubleshoots the issues, if any. Now, there was a monthly review format where each consortium member have to submit, fill this format and submit to the association. And then you also can see we have a WhatsApp group where 332 members were there at that particular time. It's a screenshot of that WhatsApp group, in which also we used to share the information from one institution to another. And we have n number of meetings with this consortium. It held at a different hospital. This is one meeting which is happening at my organization, where the district TB officer is taking a session to the people in my hospital. And again, we have been awarded as the torch bearer for TB prevention in my organization. Coming to another organization, it's an Ashram hospital. There was a meeting at that particular place also, and this meeting is happening. These meetings are happening from one hospital to another hospital. Now, these slides very clearly show you what was the condition of notification of reporting at Calicut at that particular time, and how it has been jumped. More than 100% jump was there, like 2017 only 643 notification, and 2018 606, and it jumped into 1137 as soon as we initiated this consortium activity. And then there was no end, it was going regularly, and the statistic was up to 22 is being presented over here. That was one of the main achievement of this consortium. Now, other notification of total notification of the district was also very less, was from the private hospital. Much were from the government hospital. Now, 2009 onwards, you can see even the private hospital also equal number of, they have started notifying the cases to the government. So that's what you can see from 2019 to 2022, the status which is present over here. So that was our great achievement because of this consortium. Now, again, on a various different ways that DBT, microbiologically confirmed, UDST offered treatment in the private, and treatment success. All these you can visualize in this particular chart, that how improvement has been brought by the formation of this consortium, and how much notification and how much patients were benefited. One most important thing I would like to highlight over here, that after the COVID pandemic in 2020, what has happened, much of the private government hospitals were utilized for treating the COVID patient. So the patients were not getting TB treatment from those big private hospitals, like including the medical colleges. So what this consortium at this particular time, they came forward on a stopgap arrangement. They have provided free care to the TB patient who are getting care from the public hospital, and they could not access that public hospital due to COVID. So that was the initiative, again, a great initiative which has been, I'm talking about Calicut district, maybe other district also that may be happening, that Dr. Ragesh can only vouch. But in Calicut district, that was happening, and which has been appreciated by the mayor as well as the collector at that particular time. And we also have a consortium facilitated a COVID-19 response mechanism in the district during those particular type of team. And you might have seen in my slide that even during the COVID time also, the reporting was not stopped. It was going ahead during the COVID time also. We had online meeting during the COVID time, and then we used to discuss how we can contribute in the government initiative in the step activities. And now what has happened at the end, the government, the private hospitals themselves consider accountable and answerable to government for reporting TB cases and ensuring appropriate treatment for the patients. If the patient prefer to take the treatment in the private hospital, they can be helped, or if the patient wanted to go to the government hospital, they will be directed to the government hospital. That provision is also being given. And in some certain instances, the medications have been given from the government hospital to the private hospital, where the patient can come to the private hospital and take the medication. Why? Because much of the patient, they don't want to go to the government hospital because of a big queue. When they come to private hospital, that queue can be avoided. So that is also being happening. So proudly I can say, by formation of this consortium, we could achieve maximum notification and the contact tracing, because we tell the patient the tracing, their children, their elderly people in the family, they also have undergo the various testing, and the contact tracing is also being done. And we hope that in Calicut, maybe in near future, we'll be able to control TB. Thank you so much for your patience listening.
Thank you, Miss Gracie. That was amazing presentation, I would say. As a representative from the consortium of private hospitals, you really gave us an idea about what it looks like to manage such models within this consortium. We really appreciate that. It's really nice to see how you closely work with the NTEP program as well, by engaging with district TB offices and all that. It's really wonderful. And also the other point, what you mentioned, despite the crisis times, the COVID pandemic times, you were able to sustain this model and actually contribute more to the system. So that really shows the success of this model. Thank you very much for highlighting your perspectives.
Thank you.
Next, we have the second panel member, Dr. Sunny P. Orathal. Dr. Sunny P. Orathal is a medical superintendent. He is working at the Preventive Health Checks, Rajagiri Hospital. He is a physician. He has experience working in Government Medical College, Ernakulam. He also holds a membership in Association of Physicians of India. He is also a life member of Indian Medical Association and membership in other reputed associations. To his credit, he has a lot of achievements. He has held several administrative positions in Kerala Government Medical Officer Association, Indian Medical Association Cochin, Indian Medical Association Kerala State, Ernakulam Medical College Teachers Association. So he has vast administrative experience. Thank you very much for joining us today, Dr. Sunny. Please tell us your experience as a private tertiary care center, running STEP Center for the last 3 years. What are the most valuable messages you would like to share with us from implementing the STEPS framework to ensure standards of TB care in your facility? Over to you, Dr. Sunny.
Thank you for your introduction. I don't know how you gathered this much of information about me. Before I proceed with my detailing about your question, I think I will ask my colleague Dr. Susan, who is a public health expert as well as she's also very much active in steps, and she's actually running the show. Even though I am the administrator, I am the medical superintendent, Dr. Susan is taking care of the things. We have got a hospital of 48 specialties. Myself as well as Dr. Susan is very much in contact with almost all specialists here. So we are running this steps very much active in our hospital. So Dr. Susan will take care of that, and after that I will answer your questions. Dr. Susan.
Yeah,
Thank
sure.
you, sir. So just a brief look first into how STEPS operates at Rajagiri. And STEPS definitely is an example of public-private partnership. And we are very proud to be a part of it. Moving on, Rajagiri is an NABH and JCI accredited hospital that has its origin way back in 2014 and has centers of excellence in gastrosciences, the Rajagiri Cancer Center, and recently addition is the Rajagiri Robotic Surgery. So those traveling across the milestones of such achievements, we have been also part of the STEPS program. So the STEPS program basically it comes under the Department of Pulmonology and the Department of Clinical Epidemiology. And here, as you see, are our staff from pulmonology who are the basic stakeholders in giving medications as well as counseling for the patients who come. So under the STEPS organogram, at the head, we have Sunny sir, our medical superintendent, who oversees the program in its entirety, both the clinical aspect of treating a patient with tuberculosis, as well as the running of the STEPS program in the hospital. And to aid, sir, we have Dr. Rajesh, our head of Department of Pulmonology. Sir is well oriented with the treatment aspects, the guidelines, as well as the testing aspects. And on the other side, the Department of Clinical Epidemiology, myself, we ensure that there is complete reporting of STEPS, or TB positive patients or patients who are started on TB treatment. Now, to aid in both sectors, definitely we have the Department of Microbiology and Infection Control, and linking to all this are the heads of all other departments. So any patient who comes with symptoms or signs suggestive of tuberculosis definitely goes for a testing of tuberculosis, be it pulmonary or extrapulmonary. So once we are tested positive, or if we have a suspicion and we are going for empirical TB, definitely there is a pulmonology consult, and so Rajesh sir comes into the loop. Parallelly, those who are tested positive for TB are also reported, and hence we directly go for the NICSHE registration from our department. And those who are, and then also we have a reconfirmation, because from the DOT center that is in our Department of Pulmonology, patients are also sent in so that there is an elaborate contact tracing at the initial point, counseling on other benefits as soon as they are part of the program. So they are aware of it, and this counseling is also done in a detailed, repeated fashion when they report to the Department of Clinical Epidemiology. And finally, the consecutive visits are there to assess adherence. And also, as Rakesh was mentioning earlier, there is a call from the department to ensure that treatment is going on and versus any other difficulties. So, as I earlier mentioned, there is a detailed counseling for the family members regarding many aspects, which also helps in treatment adherence and follow-up support. Contact tracing is done in the initial phase. Drug susceptibility testing is something that we offer, is being offered to the patients with the help of the government. So this is definitely an upside for them, and they are sensitized on these matters, offering TB preventive therapy. And many a times we were also able to link with the periphery through the direct communication with our center at the district. So this has helped us where we cannot directly communicate with the primary health center. It is through the district we have been able to offer them support that the patient probably is transferred out or the patient requires such and such support. So that has been a definite up for the patient to know that a private sector could help them through the PHC in their house nearby. Counseling on airborne infection control measures at household level, and the infection control department definitely sees that a positive pulmonary case is in our negative pressure rooms. And most importantly, all the difficult cases we have been able to take across to the state TB medical board. That has definitely improved our understanding of the current situation and taking care of the patient. So I think I will move on and to give this part to Sunny sir, who can elaborate on what are the key lessons. Just quickly running through, definitely trust in the patients, in us regarding treatment and many other aspects, because it is very detailedly being given to them at a point where they come in for where they only expect treatment. Many other aspects are being conveyed to them. So this definitely improves their trust and happiness. That is a definite something that we have very happy to experience from through the STEPS program initiative. Patient privacy is something that we have learned is some patients, because of the stigma associated with the disease, they do not want to take it sometimes from their nearby government sector. So they do come back to the hospital. So the first thing they ask is my treatment or are my details going to be private? Can I ensure that only the hospital and the required government officials are only aware of it? So this is something that has enabled to improve trust with our patients and has gone a long way in improving adherence and safety precautionary measures. To allow them to know about the IGRA testing facilities right within our hospital, as well as if not, they are not willing from within the hospital, the nearby government facilities also are conveyed to them. The DBT definitely makes a big change, all the benefits associated with the program. And what we have been able to also see is a clinician support indirectly within the hospital, but they are becoming a part of a public health program by ensuring the different steps. So this is definitely, which we feel goes a long way through supporting other public health programs. And public or the private sector is also playing a more pivotal role in contributing to public health is something that gives us also immense happens. So to detail on the other questions also, I will pass it on.
Thank you, Dr. Susan. As Susan mentioned, the activity is very much in place in our hospital. So she has narrated all the details. So other than that, my experience is that I was very much engaged with the RNDCP right from 1993 when this was implemented in Kerala. So in Kerala, Pathanamthitta was the first district, and later on all the districts took over RNDCP. So I was in charge of RNDCP at that time in Ernakulam district. So we could successfully implement the program in Ernakulam district. I was in charge of a district TB officer for 10 years together. So later on, I was transferred from district TB center to General Hospital Ernakulam. Why? Because I am also a physician, so I was transferred from there. So thereafter, I was not very much into the activities of RNDCP, but I was always in constant touch with the RNDCP program, and STEPS is an excellent initiative with regard to RNDCP program. And as Dr. Rakesh mentioned, private partnership can be a good initiative. And more than that, as Rakesh mentioned, a patient that is lost from the private sector is also a loss for business follow-up. So it's a very good statement. If you take that into account, I think we can move a bit forward. So my association with the RNDCP and STEPS program starts, as I said earlier, from 1993. I was together with Dr. S.S. Lal, and I was with Dr. Shibu Balakrishnan, Dr. Rakesh. And right now, lot many doctors in pulmonology setup is in constant touch with me. Dr. Sophia in Government Medical College, Dr. Akhilesh is in Amrita Medical College, and I am very much in touch with Dr. Salim, who is the district TB officer. Even last week, we had a seminar on RNDCP, the latest initiative in 2024 in Association of Physicians of India. I am a member of Cochin Thoracic Society. I am a member of Academy of Pulmonary and Critical Care Medicine. I am a member of Association of Physicians of India. Very much active in IMA, and I was in KGMI also. So I had a very good contact with the leaders of this organization. So wherever I move, whenever TB is a talk, I take the initiative and I'm leading the things there. But one thing I should say, as Dr. Gracie Mathai told, there was no initiative of a TB-free Calicut in Cochin. So I think it's a very good move. You have to think of a TB-free Ernakulam in coming years. That's all from my side. Thank you.
Thank you, Dr. Sunny and Dr. Susan, for that detailed presentation on how the STEPS model is actually implemented in the hospital setup. That was very useful for us. I really liked, like when you said, it really improves patient experience with respect to TB care. And I would like to reiterate the point mentioned by Dr. Susan, how this STEPS program is setting a precedent actually to secure and support or integrate other public health programs within the private health sector. Thank you very much for highlighting that. Thank you, Sunny. Now, I would like to invite Dr. Upasana Arora, our next panel member. She is the director of Yashoda Super Speciality Hospital and she holds multiple other prestigious positions. She is the co-chairperson of the ASOCHAM Healthcare Council, chairperson of SCPC Healthcare Sector, and also vice president of North India Council, Indo-American Chamber of Commerce, AHPI, Delhi NCR region, and many others. She has been awarded numerous times for her contribution to healthcare sector in a career which spans 22 years. We are very happy to have you, Dr. Upasana, with us today. We have a very specific question to you to ask. Being the director of a super specialty hospital, what motivated you to start STEP Center in your hospital, and what are the challenges you faced while implementing the STEPS model in your hospital? Over to you, Dr. Upasana.
Thank you so much for giving me this opportunity because TB Mukt Bharat is my passion, and I would like to tell that we have started this journey TB free India or TB Mukt Bharat Abhiyan in 2022. We have adopted 5,100 TB patients of Ghaziabad, and we are looking after them. We are providing them food, nutritional food, then looking after them. So that is how, and I'm thankful for all this to Union because they introduced me to this problem. I met Dr. Midhun and Shija. They approached me to, just involve with this program. And after that, we have not turned down our this motivation and our goal, and we are going further. That is how, when we were doing so well, then I think we decided to do something further. So after listening to our Gracie Mathai, who works with me in NABH also, and she's my mentor. She's so senior and so motivating lady. I am also planning to start consortium because in my area, Yashoda is the biggest hospital and all small hospitals are always looking at us. So in NABH also, I have given them all the knowledge and providing them stuff to read and go further for NABH accreditation. In the same manner, like my hospital is a pharmacovigilance center also authorized from Government of India. So I am providing them all these, things. They can come to me, they can learn from us. So in the same way, I am already spreading this word to other hospitals that they have to send their TB patient to us because our hospital is a STEP center. So what we are doing in this STEP center, that we are, as we were already doing all this, that we were providing their nutritional food, that we were putting their name in the Nishchay portal, and we were periodically follow up of the on individuals under TB treatment to ensure their TB treatment adherence. Like we are providing them enabling their direct benefit transfers and then universal drug sustainability testing and more. So what happened that other hospital also sending their patient to us, but we have not given any formal name to that. So now we can, say that it's a consortium of private hospitals. So it will be a great initiative for our area, which is because my center is a first step center in North India. So I would like to tell you that I have already met to the Government of India TB officer, and I am planning and I am talking to union also, because we want to start DR center also. I have located a land, and I have all the facilities, all the construction work and everything we can do. But I need some technical support from somebody who is really good in making a DR center. And same time, I just wanted to spread this news among all those who are, suffering from this infertility. There is a problem with TB also, that females who are not getting pregnant, there is a problem of TB. So we have organized a camp with the union to our IVF center, just to create awareness among everyone that there is a problem of TB also can lead to you in infertility. So these are the things which we are doing, and our nodal officer, Dr. Chavi Gupta, who is a infectious disease doctor, and we have a very good team of pulmonologists. We have 5 pulmonologists in my hospital. All are involved with this step center. They are referring to the TB patient to Dr. Chavi. And if there is any need of second referral, they are referring to others also. And the best part is this: our patients are not missing doses. And when they are cured, we are keeping a record of that, that now this patient is a TB free patient. At the same time, what we have done with the union, what we have done, we have initiated, new thing, that TB free office place. So, because my hospital is on panel of lots of TPAs, different multinational companies, so we have sent our team to their places where they have gone through this TB testing, and if there is any need of the treatment, we have given to them. And always we are trying to provide them knowledge about how to prevent TB. So these are the things which is really important. And for precaution also, we are taking care of the family, friend, and contact person, because lots of people are not even aware that if somebody has come into the contact of a TB, especially open TB patient, they need to have some precautionary drug. So all these awareness we are doing, and union is our partner. So whenever they need any kind of screening places, we are sending them to other places. So that is how we are working hand in hand. And I think this is going to be a very good initiative of India. And we had a target of that we are going to complete this abhiyan in 2025, but that is not possible. So it will be end till 2030. That is my, I think, because all those small hospitals which were not even aware that how to make a isolation room for TB patient, or how to track them, how to counsel them. Like I have a full-time psychologist who is counsel patients and the family. They are doing all this thing, and Dr. Chavi is playing a major role with the help of all the pulmonologists. And especially I would thank to this program. Sorry, I think I am just so. We tried our level best to create a TV Mukt Ghaziabad, and I think we are going to get our this goal done within 2 years, because we are continuously tracking those patients who came first. And if new patients, we are also, even when they are not coming to us, my van who is going to give them food, they are going with the doctor also, so they can see their progress, because for food these people are coming every month. So that is how we are trying to remove TB from Ghaziabad. And I am really thankful to union who is working with me day and night. And hopefully lots of people who are here, they are also working like this, and we can make this change together. Thank you so much. Over to you.
Thank you, Dr. Upasana Arora. And congratulations on introducing the STEPS model to North India. This is very interesting. And yes, very important. Like you said, local efforts matter a lot. Though we have this global goals and national goals and all that, local efforts, it's really important to adapt our strategies and approaches to end TB in our country. Thank you very much for highlighting that, Dr. Upasana. Not the last, we have now, I invite Dr. Sunil Ketarpal, other panel member. Dr. Sunil Ketarpal is the Director of Association for Healthcare Providers India. He is a very distinguished and astute administrator with a very rich experience spanning more than 30 years. Currently serving as director at AHPI, he has the experience of working in leadership roles with the best hospitals in the country, including Shalby Hospital, Rajiv Gandhi Cancer Institute, Metro Hospital, and others. We are very, very happy to have you, Dr. Sunil, with us today. So, to you, we have a very specific question. We know that AHPI is an umbrella organization which has vast membership of several kinds of private healthcare providers in India. So, we would like to know what motivated AHPI to advocate for the establishment of STEP centers within your member hospitals. And also, we would like to know what made you to believe in the primary strategy to motivate hospitals to adopt the STEPS component. And also, please share your challenges that you faced while reaching out to the member hospitals to introduce this initiative. Over to you, Dr. Sunil.
Thank you, Meena. Thank you, TBPPM Network, for giving me an opportunity to speak in this webinar. And I must congratulate TBPPM Network for organizing this webinar on a very, very important topic where all the stakeholders are there to share their experiences. So just to brief you about AHPI, the Association of Healthcare Providers, we are a not-for-profit organization, and we represent the vast majority of healthcare providers in India. So we have a large membership of 15,000 plus member hospitals, and we are present across the country through the 20 state chapters. And the vision of AHPI is to have a healthy India encompassing the society, community, and common man at the grassroots level. So we want to reach to the last mile, and the mission of AHPI is to work with all the stakeholders. So we work with the government, with the regulators and other stakeholders in establishing universal access to basic healthcare services. So to achieve universal health coverage, that is accessibility, affordability, and acceptability, that is quality care. Now, AHPI launched its NTB initiative, and it was sometime in August 2023, first week of August, we launched this NTB initiative program to advocate the systems like STEPS and ensuring uniform standards of TB care, which is very, very important, among all the hospital members, in collaboration with the corporate TB pledge initiative hosted by the union. So we work very closely with the union, who has been very supportive to us. The team led by Dr. Rakesh and Midun, Shrija, and all. So, and you can see the signing of MOU between AHPI and the corporate TB pledge as a part of our commitment to support this national TB efforts. The Director General of AHPI, Dr. Giridhar Gyani, and Dr. Rakesh from the union. What the key factors which has influenced our decision to advocate for establishment of STEPS centers within our member hospitals, the most important factor is the access and convenience due to the patient-centric approach. Now, as we all know that STEPS, I think STEPS have been talked about in detail by Dr. Rakesh, and our previous speakers also, they have shared their experiences and, the good work they are doing in this area. So STEP centers, we all know that it provides streamlined tuberculosis diagnostic and treatment services within the private hospitals, which enhances the accessibility for the patients. So this is very, very important, the accessibility part and convenience. Number two, ultimately, we are all concerned with the outcome of the treatment. So outcome is, when we talk of the quality of care, that means the desired outcome is achieved. So by ensuring the standardized protocols, by following the standards of TB care in India, STEP centers improve the quality of TB care in our private healthcare settings. The third important key factor is the public health impact. Now, supporting these efforts, actually, it is in alignment with our mission and vision. AHPI's also commitment to the public health and, of course, to contribute to the national goal for TB elimination. And we strongly support this program. And lastly, the regulatory compliances. Reporting all diagnosed regulatory compliances also, which is facilitated through the STEP Center. Now, reporting all diagnosed TB cases to the health authority, TB control program, or the TB control program as per the specified notification requirement. This includes, notifying the new cases, not only notification of the new cases, but also the treatment outcomes and any incident of drug resistance. Then the strategies, how we have motivated our member hospitals. So it's very important to motivate and encourage the hospitals so that, and by creating awareness and so that there's active participation by them. And first thing is we conducted, various workshops and webinars for our member hospitals so that to make them aware about that what benefits they would have, not only the hospital, but all the stakeholders would have, mainly our patients, by adopting steps. And then we have been sending various reminders, constant mailers, sending mails and WhatsApp messages for implementing steps. Then mobilizing through the state chapters, because as I told you in the beginning, we have 20 state chapters. Basically, we are present pan-India. So in each state chapter has an empowered executive committee. We have a president, we have a vice president, a secretary, and 8 to 10 executive committee members in each state. So it is an empowered committee. So through the state chapter, we reach, to our member hospitals in different states, because health is a state subject. So it's very important to involve the state chapters, and through them only we can achieve this mission. And sometimes we are also communicating directly to the potential corporate hospital groups for initiating steps, and we have even succeeded. And union has been very supportive to us in this implementation of steps for providing the technical assistance, technical guidance, technical training part, and persistently guiding the hospitals for implementation of steps. This is the HPI NTB initiative impact. You can see we launched, as I mentioned in the beginning, that NTB initiative was launched in August 2023, with the support of the union. And then in February 2024, we had this workshop for corporate hospitals for enhancing quality of TB care. This was in New Delhi. And we had a very good participation of 20 corporate hospitals or private hospitals from Delhi NCR region mainly, who participated in the workshop. And I must tell you that during this workshop, all the 20 hospitals which participated, uh, they committed to support this program and implement steps in their hospitals. Of course, it is a voluntary process. We can only motivate and encourage the hospitals, but we can see the results, the impact of these workshops. And gradually we are having more and more hospitals on board. And you can see in the slide on the right-hand side, the 4 hospitals, prominently we have mentioned their names, the Fortis hospitals, Yashoda Super Specialty, Kaushambi, Dr. Upasna has already shared, the good work which is done by her. And then Saigal New Hospital is a 200-bedded hospital. And the secretary, the owner of the hospital, Saigal New Hospital, is the secretary of HPI Delhi chapter. So they act as a role model for other hospitals. And of course, Amrita Hospital, Faridabad, is doing a fantastic job. And they have actually initiated steps in this part of the country, in the northern India. And many other hospitals here, more than 9 hospitals, they are in following in line. So, and in the process of initiating step center. So things are happening though, and we are constantly driving this movement for implementation of steps among our member hospitals. Then these are some glimpses of, launch of step centers in all those 4 hospitals which I have just mentioned, the Fortis, of course, Dr. Upasna's hospital, Yashoda and New Cycle Hospital, and Amrita. Yeah, so you can see this uh, the launch for HPI and TV initiatives. No, and kind of keep on motivating our member events. And we are some interruption. Yeah. You can see my slide.
Yes, we can.
Am I audible?
Yes, you are audible,
Okay.
Dr. Sunil.
Yeah, thank you, Meena. Thank you. So training and capacity building is very important. By providing training to the hospital staff on management of tuberculosis and integrating steps into this existing healthcare services. So this is something which will actually train staff who will be actually, will be very helpful in implementing steps. And the successful implementation of steps can only happen when the staff is trained. And so this is again with the help of the union only we are doing it. So they are always there to support us in every initiative, in every activity which we do for this initiative. The union is always there to support us and guide us. And the partnerships, of course, the collaborating with the HPI member hospitals to pilot the step centers, we demonstrate success. And of course, to encourage broader adoption of steps. Now,
Dr. Sunil, we can't hear you clearly. May I request you to turn off the
answer
video?
to your that how the leveraging steps. Turn off my video. 1 second.
Yeah, maybe that can save some internet. Yeah.
Okay. Is it clear now, Meena?
Yes, it is clear. Thank
Okay,
you.
thank you. So lastly, your last question was that leveraging steps. How would we leveraging steps would benefit the public and private partnership in the TB control? So if you see, there when all the stakeholders they come together and collaborate, especially the collaboration between all the public health agencies and private hospitals with the National TB Control Program. So this is very important. There's shared goals, of course, which foster collaboration between all the stakeholders. And then resource utilization. And because private hospital has that kind of infrastructure and they have that kind of expertise, so we should make the best use of them. And by utilizing their strength of infrastructure and expertise, which can expand the reach and effectiveness of TB diagnostic and treatment services. So we must encash on their strength. And then another point is that sharing of data, of course, and monitoring. So establishing mechanisms for data sharing and joint monitoring will enhance the accountability and effectiveness. As Dr. Rakesh very rightly mentioned in his presentation, the accountability part. So this is we should not miss this accountability part. This is very, very important. So joint monitoring and which enhances the accountability and effectiveness in TB control efforts. So whatever we do, it has to be effective. It is not just for the sake of doing it. And lastly, the capacity building, which I already mentioned, I think supporting the private hospitals in uh, TB management through steps will build a long-term capacity and sustainability in public-private partnership. I think sustainability is a very, very important factor. When we implement a program or we initiate a new thing, we should think of, that we will scale it up, and then ultimately this program should sustain and to benefit all the stakeholders so that we achieve our goals. So by addressing all these factors and strategies, AHPI can effectively advocate for step centers in member hospitals and strengthen the public-private partnership and contribute significantly to the TB control efforts in India. And thank you very much. Thank you.
Thank you, Dr. Sunil, for that presentation. We really appreciate the values that inspired AHP, a collective of healthcare providers, private healthcare providers in India, such as patient-centric approach, quality of care, public health impact, and regulatory compliance, how that has inspired AHPI to take up the STEPS model. And thank you for highlighting the importance of leveraging the networks and partnerships to create synergies for TB elimination in India. Thank you very much. I see Dr. Upasana has raised her hand. Upasana, briefly, your comment or question, please.
So I just miss this one thing which I want that others should also do, as I am part of all the chamber and councils like FICCI, SOCHAM, CII, Indo-American Chamber. So what I am doing whenever I am organizing any conference, I am always keeping one session for TB Mukt Bharat. So that is how at least we have a gathering of 150 to 200. So what is happening after this conference? I am getting lots of queries from other hospitals or whosoever was our attendee that how you are doing, kindly help us. So in this way also we can spread this step center model to others as well as how to manage this TB Mukt Bharat program of India. And best part is that union is always helpful, so we can ask them to do so. So I just wanted that all my fellow colleagues who are here, they should also, they can, it's not, I am just suggesting, they can also take, because everyone is into some conference or something like that. So we can, spread the news to the every hospital, whosoever are, like I am planning, I am organizing a conference this in September under CII. So I am going to ask USAID because I work with USAID also, and for many reasons So I think that time Union will be my partner and USAID will be my partner. So we can, and AHPI, I am a part of AHPI also. We can, reach to everyone in the same manner.
Yeah, thank you, Upasana. Thank you so much. So we have one last intervention from Dr. Rakesh. We know Dr. Rakesh has vast experience working in the field of TBPPM and STEPS model. In fact, implementing as well as evaluating the framework. So, Dr. Rakesh, please shed us some light on how, what are the potential challenges in scaling up this particular model within India in different states and beyond India as well. What kind of adaptability measures we need to take if we have to implement this model in diverse settings? And the other question we have for you is, are there any recent advancements or emerging trends in engaging hospitals and collectives of medical practitioners in TB control efforts? How can we leverage these to strengthen
Meena,
TB?
just one line in between. As such, this step is going on very nicely in Kerala, across the Kerala. But I don't know how, what about in other states?
Sure, sure. Yes, thank you, Gracie. Over to you, Dr. Rakesh. Would you like to respond to these questions given your vast experience and expertise?
Yeah, thank you, Meena, for this question. So I was happily listening to all the leaders here. I mean, so I have heard from Gracie Matai, the leader who talked about how the entire private hospitals came together and they tried supporting how they partnered with the government to help the society. Ultimately, we have heard that word. We have heard the words of Dr. Upasana Arora, who is again the leader whom we are actually looking at, and see how passionately she talks about TB Mukt Bharat Abhiyan and her ensuring quality care to her patients. We have heard Dr. Sunil Ketrapal, who is the Director of Association of Healthcare Providers of India, who talks about how much he is advocating with the private hospitals for taking up these initiatives. I'm sure that when we have also heard Dr. Sunny P. Oratil about the initiatives which he is actually talking. And so many commitments are also coming from the leaders in this webinar itself. So what I wanted everybody to listen to is that they are the leaders from the private sector, very passionate leaders who we have not heard. We have heard only about their passions for doing something from all these leaders. We have not heard anything about financial incentives. We have not heard anything about such kind of words from these leaders generally, actually. So what I felt is that, I mean, whenever we talk with private, this is the same language that I am also listening. So I talk with private sectors of many places through all these people. I have heard all these leaders talking using the same language, basically, about their passions, about their commitment, about their social responsibility, about their concern for their client, about their concern for the quality of TB care. And nowhere what I am actually, I have not heard anything about need for financial incentives, all this sort of stuff generally. So this is one generic approach which I wanted everybody to rethink and consider about that. What is required is a support system generally. If you're looking about a challenges, the important challenge will be creating the support systems. When the private sector is coming forward and saying, we will do things for that, what we need is a support system surrounding that. For example, some of the clients may not be able to do NAT test for a high cost, so they may need to send the NAT to the private to the government facility. Patient cannot travel, so we need to send the samples. So is there a specimen collection transportation system as a support system if somebody could establish? What I have seen in some of the hospitals recently, when I went for evaluation of some of the hospitals in Karnataka, what I have seen is one of the hospitals, they're collecting all the samples in their lab and they're sending it through a staff in the private hospital itself to the nearby government facility for getting the test done. So that is something, that kind of support systems as actually the agencies or the government or the PPSAs or something that we need to create for supporting these providers. That is something that we really need to look at. With related to the private sector, I have not seen any challenges anywhere because whomever we are actually talking to, they are all willing to be part of this STEPS movement. They are all willing to be parts of, they are willing to undertake this section. Because if you generally look at the structure of the STEPS, there is not too much investment that we are actually expecting from the private sector. They all are socially committed. Plus, it's not a loss to the private sector also, which you already discussed about that. So there is no challenge that we are actually facing from the hospital management. If you rightly talk the hospital management, all hospital managements, we have heard Dr. Sunil Ketrawal saying Fortis is coming, Apollo is coming. So they're all willing to be part of this movement. So there is no challenge from the private sector generally as such. But only thing is how to create support systems for helping the patient. That's something that we really need to think about. With related to the global or the how to leverage upon the organizations, coalitions, and all. I already mentioned that globally there is a movement. Recently, I have witnessed where leaders from 12 countries, they came together. They looked at the steps. They visited some of the private hospitals here, and they figured out that, okay, this is something that we really need to do. And they all said that it is such a simple model. It is such a powerful model, and it's a powerful structure. It's a very simple model. There are no complications involved in this model at all. So they all really wanted to replicate such initiatives in their own countries. What may be required is a form of, some initial technical support, which I believe anybody working in the technical field in India can actually provide. Dr. Upasana and Dr. Sunil was talking about unions support, but I feel there are many agencies like WHO is providing technical support for establishing steps. In many of the states, what I have seen, many other organizations, all the organizations working in the PPM network. We have Dr. Vijayashree. I could see Vijayashree here. She's the vice chair of the global PPM network even, and global PPM working group of the WHO. So these kind of lessons, I feel that if you try to utilize all these existing structures, coalitions. So AHPA is one organization. We have seen such a powerful structure they have. They're working on, and all their members are closely, their members are the hospitals, they are very closely attached to them, and they have a very clear channel of communications also. If we just leverage, we just need somebody need to go and talk to them, so things will be in place. So we need to identify the right people. We need to identify, tell them the right messages. We need to rightly support them. The leaders will.
Did we lose Rakesh? We're not able to hear, I think.
Some connectivity problem, I think.
Yeah, Rakesh, in the end, we lost you, but we heard your message. Yes,
Okay.
we need to get across the message right to the right people. And then this model is definitely possible to scale up in any context. Thank you for that message. We are almost towards the end of the webinar. So now, audience, it's your time. You can pose your questions, your thoughts, reflections to any of the panel members, any of the presenters here. So yeah, please make use of this opportunity. I just saw one question in the chat box, but if you have a question, please raise your hand and then you can come in. Yeah. Any questions? Participants, please raise your hand. Listening to the STEPS model, if you have any thoughts, reflections, any questions would like to ask to any of the panel members, please feel free to ask. I don't see any hands raised.
Hello, Meena.
Yes. Hi. Hello,
Yeah.
Vijayashree. Very happy to have you here.
Hello, everyone. Excellent panel discussion. Very insightful, very practical. And we have been looking at so many models, but this webinar brought in the how processes. Excellent presentation. So, having said that, Rakesh, this is particularly for you. I was wondering, this is an excellent model, and how do we take it to the global level? Um, let's think offline sometime. Can we make a policy brief or a brochure where we could start advocating this model to the other high TB burden countries as well? We have done a good work with the medical college. I joined the WHO network in 2003-4, where we were really struggling to get the medical colleges on board. Now the need of the hour is to get the corporate hospital, big hospitals, and I think this model has demonstrated the processes. So let's think a bit on it, Rakesh. How do we package this for the global audience? Thank you so much.
Yeah, thanks to Dr. Vijayashree. Now you are the vice chair of the global WHO Global PPM working group also. So, I mean, we are looking at you. So, I mean, whatever support you require, we are there to help you. And all the entire private sector, like you have seen all these leaders, they will all be with you for any sort of help or support. WHO India, because this initial concept and everything has been conceived by the WHO India office only. So Dr. Shibu was supposed to present here today, but unfortunately he couldn't come. So probably we can have a meeting with Dr. Shibu, WHO team, and you just guide us what you really want. We are always there to help you.
Thank you. Thank you so much.
Thank you, Shri, and thank you, Rakesh. There is one question in the chat box. Shailaja is asking, in which states IAP coalition for STEPS model is present in the country? Rakesh, would you like to respond to this?
Yeah, so Kerala is a one state which we have seen. It has been initially piloted. Almost 324 hospitals are in Kerala. Karnataka is a state through PPSA and the State Technical Support Unit. The STEPS has been really established well. So almost most of the STEP centers are in Karnataka, generally, if you look at in terms of numbers. Tamil Nadu has implemented this thing in the form of a fast, the concepts and philosophies are same, but they call it a fast. But Coimbatore district of Tamil Nadu, they have piloted this same thing here. We have seen new hospitals coming up in UP, Dr. Upasana Arora's hospitals in UP. There are plenty of hospitals who are committed in Delhi, and there are a number of hospitals who are committed in Haryana also with related to STEPS initiatives. Wherever, I request that, the presentations or the purpose, it's very difficult to read and understand. So it will be very easy for us to visit one of the STEP centers and figure out what is happening there and interact with some of them. So if any of you needs to visit any of the STEPS facility, I believe Midhun is here from the corporate TB pledge, or even the TBPPM learning network can also take up that initiative. We'll be happy to facilitate a visit to any of the STEP centers and look at what they're actually doing for your easy understanding. So as of now, Kerala, Karnataka, Tamil Nadu, Haryana, UP, Delhi, we can actually facilitate visits very soon. And some of the states are quickly starting this very soon.
Yeah. Thanks, Dr. Rakesh. And there is one question related to pediatric case notification in the chat box. So Vijaya Dage is asking, what is the impact of this model for pediatric case notification? Any panel member can respond.
Yeah, I have actually answered that question there itself. So this basically helps in standardizing, basically. So what has happened in different places, the impact will be different. But what happened in Calicut, the specific question was to the Calicut, but what happened in Calicut was like, Calicut already the pediatric TB notifications was significantly very higher in terms of 12% of the entire notifications at that time. But what the coalition, especially the IAP, played a very important role there. IAP has come up with a commitment. They have come up with a project as a part of the coalition and as a part of their commitment. And they came up with a TB-free initiative, TB-free air for every child initiative. And they tried training each and every pediatricians on the protocols. They trained the staff nurses on collecting the GJAFP. All these were IAP's initiatives which they have done. They even started peer auditing. For example, they wanted to standardize the process. They even started a peer audit systems in Calicut. They established a difficult to treat pediatric TB committee with a 5-member team in Calicut. So all these were IAP's initiatives as a part of their commitment as a coalition member of TB-free Calicut initiative. With related to that, so it had a significant impact on standardizing the pediatric TB practices in the Calicut. Obviously, yes, pediatricians are also part of hospitals. Pediatricians are also part of the coalition of professional medical associations. So the impact is expected across all sectors if you really carefully do that. Pediatrics, geriatrics, any sectors, including extrapulmonary. If you start looking at some of the centers, including extrapulmonary tuberculosis, they are trying for 100% microbiological confirmations. They are putting their maximum effort to ensure STCA to all clients, even with extrapulmonary tuberculosis even now. So it has impact. If we just need to carefully package what we really want, we will get the results.
Yeah.
Moreover, Rakesh, even we are motivating the parents when we found that they are of TB, we tell them that to bring their children also for the free checkup so that we can identify it's in the early stage. That's again there. And as very clearly he said, not only pediatric, the extra pulmonary is nowadays more than even the pulmonary, what you can say. So that way also clinicians are involved into that. And the district TB officer, when they come very regularly to the hospital, when we call or otherwise also they come and they take sessions to the clinicians, specifically not to the pulmonologist, but to the other people, because extra pulmonary cases are more.
Yeah, with related
Thank
to
you.
yeah, so you just carefully listen to the word said by Dr. Gracie Mathai. We ask parents to bring their child for a free checkup. So that's how they do contact investigations, basically. I mean, it may not be free everywhere, but I'm just requesting you to carefully listen to the word told by Dr.
No,
Gracie.
the TB is free. I am not telling every care is free. Only for the children's checkup is being free. That's what.
Thank you, ma'am.
Thank you, Ms. Gracie. There is one question from Dr. Satish. Satish, would you like to come in to pose your question? And
Yes,
this will be
ma'am.
the last question. Yeah.
Yes,
Over to you,
ma'am.
Dr.
Yeah, good afternoon. Actually, I wanted to understand the mechanism of sample collection and transportation mechanism from private hospital to the government hospitals. So, how frequently samples were transported, and who were the persons who were transporting the samples?
Yeah, sure. Thank you for that question, Dr. Sadish. As far as I understand, there is no, it is basically designed by based on the need by the program managers and the hospitals generally. I have seen different models working in different districts. So, for example, initially, there was a sample collection transportation scheme signed by Government of Kerala NTP with the IME. So, Indian Medical Association, they through an MOE, they were running a sample specimen collection transportation in the initial period. So 2015, 2016, 2017, if you look at, that's one model where they appoint a person and they collect the samples. Money was given to the Indian Medical Associations for the sample collection transportation scheme. Based on the lessons learned from that, when the partnership schemes or guidelines came in, so then they started appointing various runners, basically like NGOs, who collect the samples from the private hospitals generally. So that is actually an initiative by the NTP program, who really wanted somebody to go to the private hospitals on a day-to-day basis and collect the samples as and when required. So their money is being given by the NTP program to the staff. So that scheme is still existing in many districts. Recently, I went to one of the Thrissur district where the NTP specimen collection transportation system connecting all the private hospitals are actually running. The other initiative is when PPSAs are there, wherever PPSAs are there, they usually try to have a specimen collection transportation schemes. I have also seen some of the districts utilizing local women self-help group members for transporting samples through an MOU with the, these are all based on the national partnership guidelines, basically. So they engage the women self-help group members of Kudumbashree. Only thing is the NTP need to decide whether they need a specimen collection transportation. They need to collect the samples from the private hospitals also, who are willing to provide samples based on need basis. So most of the times it will be based on, the specimen collection, when they have runners, they have a well-coordinated mechanisms of connecting all private hospitals at a particular point in time, collecting the samples. Whenever they have no samples, they will get a notification in their WhatsApp saying there is no samples. But the future will be a technology-enabled specimen collection transportation systems that's not only applicable for steps, but generally for any specimen collection transportation system. I have also seen some of the hospitals who collecting their samples and sending through their own mechanism. Say their ambulance driver will drop the samples at the government facilities. Some of the hospitals, they collect the samples and they pull all the samples, and the lab assistant will carry that sample to the government facility. So all these are possible. It all depends on how we design and how can we. There is no fixed hard and fast rules related to this.
Okay. Thank you, sir. Thanks a lot.
Yeah.
Thank you. Dr. Sunil, please come in.
Okay. Dr. Rakesh always tells us that we have to treat every patient visiting the hospital, irrespective of whether he or she is visiting in any department or any specialty. We should treat them as a potential TB patient, and the screening part, the initial the history taking. So there's one of the hospitals in Delhi. They are in the process of initiating steps. That is Delhi Heart and Lung Institute. I worked there earlier as a CEO. So they have actually implemented. They have incorporated in their initial assessment history taking when the patient first visits the hospital for the first time in any of the specialty, whether it is medicine, surgery, or cardiology. So the initial assessment form is, they are the parameters, the history taking, TB history of TB symptoms. They are incorporated in the initial assessment form, like cough for more than 2 weeks, yes or no, fever for more than 2 weeks, weight loss, and night sweats, yes or no. So these are incorporated. So pan hospital across all the specialties, this have been implemented. So this is also something I think is a very important intervention, because in this TB elimination program, we know we can have various interventions. Steps is of course one very important tool, but these small measures, I think, also will definitely help in uh, screening, early detection, and of course, early treatment of patient. And of course, this is, and if they find that the symptoms are positive, I mean the patient is giving the history of cough, fever for more than 2 weeks, weight loss, night sweats, then they subject the patient for further evaluation, for X-ray chest and whatever as per the standard treatment guidelines.
Thank you, Dr. Sunil.
This
It's a,
is also, I just wanted to highlight that.
Yeah, sure. Thank you, Dr. Sunil. It's like we have already passed 12:30. Thank you very much, all the panel members, for the rich conversation and for sharing your deep insights, knowledge, expertise, experience on the STEPS model and the potential of it for TB elimination in India. We really appreciate that. Thank you once again. We have Dr. Ramya Ananthakrishnan, who is the chairperson of the TBPPM Learning Network India chapter with us. I kindly request Dr. Ramya to share few words at this occasion. Over to you, Dr. Ramya.
Thank you very much. Considering we've crossed time, don't want to say too many things, but very happy on behalf of TBPPM Learning Network to showcase and foster this sharing of the learnings and success of each models, because for a country like India, where the private sector is huge and most of our people with TB go to seek care in the private sector, I think one size will not fit all. So we need several models. PPSA is a model, STEPS is a model. So we have several models in India engaging with the private sector. And as a TBPPM Learning Network, this platform is being created to encourage the sharing of our experiences, and not only in terms of the success, but I think what would be very interesting is also to look at the challenges and how we can learn from each other in overcoming these challenges and move forward. I hope all those who are attending this webinar are also part of the TBPPM Learning Network member, and we really encourage all of you to become members. And I want to congratulate both the Secretariat and to all the speakers for such a fantastic lineup. And thank you, Dr. Vijayashree, for joining us for this occasion and sharing your valuable advice. Thank you very much to all of you, and over to Dr. Meena.
Yeah, thank you, Dr. Ramya. We have come to the end of the webinar. So as I said earlier, this webinar series is called Let's Talk TBPPM. So this is only the first webinar. So there is a lot of other topics we are going to bring it to you. So please watch out for any notification, any information about the next topic for the Let's Talk TBPPM series. And thank you, audience, for taking your time to participate in this webinar. We really appreciate that. Thank you, everyone.
Thank you. Thank you.
Thank you.